Hi, all. Welcome to another episode of Let's Talk Health. Today we are going to talk about awareness on asthma, treatment option, and management. And to discuss this, we have with us Dr. Sangu Praveen, consultant physician, who has special interest in managing respiratory problems. Good afternoon, doctor.
Good afternoon.
So, can you just tell us what is asthma?
Yeah, asthma is a very common health condition. I don't think there will be anyone who has never heard about asthma. It's a respiratory problem, and many of us remember like children having asthma and young adults having asthma. But what really asthma means is, in simple terms, for a common man, it means allergy of the lungs. So you must have heard about allergies where people get excessive sneezing if they have allergy in the nose. They get excessive sneezing, running nose, nose blocks. If they have an allergy in the eyes, they get redness of the eyes, and frequently they get itching where they will be rubbing their eyes. Some people have allergy of the skin, they get redness, rash, itching of the skin. Similarly, if there is an allergy affecting the lungs, that is called asthma. Now, in our country, people talk about asthma in different ways. And some people say it is allergic bronchitis. Now, when you say allergic bronchitis, also you're automatically meaning that it is asthma. Now, in asthma, what happens is that a person has a problem with the lungs, where when they get exposed to certain things like dust, smoke, cold air, pollution, the lungs start reacting and the lungs become tight inside. The opening, there are tubes in the lungs which are called airways, where we conduct the air which goes through our nose into the lungs. So when the lung becomes irritated, becomes because of the exposure to these things, the tubes in the lungs get contracted. They become constricted. That makes it difficult for the patient to breathe. Initially, the first response whenever a person gets exposed to dust, smoke, pollution, all these things, supposing we both are sitting here in the room, and then let us say somebody enters into this room with a heavy perfume on them, you won't react to that. If I have asthma, I will react to that. I might immediately start coughing, wherein I will be trying to push the air which contains the perfume which I am inhaling. I don't want them into my lungs. My lung doesn't want it. So I cough and throw it out. That is, cough will be there. The next thing is, inside my lungs, my lung will be trying to produce some secretions to wash out that thing which is entering into my lungs, the air which is entering into my lungs. That's where you start coughing up some sputum, some secretions. Even after that, it's not working, then what the lung does is goes into a closure. It doesn't want that air to enter into the lungs, so it becomes tight and closed. So that makes a person difficult to breathe. So all this explains the symptoms of asthma indirectly, where you have cough, where you have sputum, where you have breathing difficulty, and also classically in asthma, you have what we call as wheeze, where it is like a musical sound, just like a cat crying, Now this happens because when the air passes through narrow passages inside your lung, it makes that fine cooing sound like that. That's called wheeze. So these are actually the features of asthma. And many of us think that asthma affects only children. It's not true. Yes, it's common in children, but any age group, they can develop asthma. So it is a common respiratory disease. But one good thing with this is there is no damage inside the lung. The lungs are actually normal lungs, but they're hyper-reacting lungs. That is what is asthma. And it happens only when you are exposed to certain things which trigger the attack of asthma or symptoms of asthma. Not always.
So, moving on to the second question, sir. What are the triggers of asthma?
Yeah, I think this is a very important thing which every patient who has asthma has to realize. Now, as I told you, asthma is a response of the lungs to external factors. And not every patient will have the same triggers which stimulates an asthma. Different people can have different triggers. To name them, dust is the most common trigger. Now, you may not be able to see the dust. It may be a fine dust. If you look into your house, there may be dust on your curtains, on your sofas, on any carpets you have. There may be dust over there. You might be thinking your house is very clean, it gets cleaned regularly, but there may still be some fine dust and your lungs may be reacting to that. Dust mite, there's this very small, tiny organism called a dust mite, which may be sitting in your sofas and your curtains and your carpets. So dust is a very common trigger for asthma. And when you go out, obviously out of your house, there may be dust everywhere. There may be construction activity near your house where there's a lot of dust. That can also trigger asthma. Cold air. When the winters come, when the rains come with the temperature drops, that also can trigger an asthma attack. Somebody gets exposed to extreme cold, like when they go to a hill station or a place where the temperatures are very low, mountainous areas, asthma may be triggered. AC, the normal AC, household AC which we use, can also trigger asthma attacks. Then when it comes to other triggers like air pollution, you can have pollen, the pollen grains from the flowers, certain trees, then food, sometimes food items when you eat, it can also trigger asthma. Emotional stress, if you're going through a period where there is a lot of emotional stress, that can trigger asthma. Exercise can trigger asthma, like if you're jogging, running, and you don't have a good control asthma, then asthma gets triggered. Then sometimes asthma can happen when at your workplace also. Supposing you're working in a factory where there are some chemicals, you may react to them. If you are working as a mechanic or dealing with cars where there is spray painting happening, if there is a fresh paint inside your house, if somebody is doing puja and they have agarbatti burning, all these things can trigger asthma. Other aspects can be smoking. If you are a smoker, that can also make your asthma bad. If you have acidity and there is an acid reflux problem, even that can trigger asthma. So there are many triggers of asthma. A patient may not have all of them, or they may have only one of them, or very few of them. Not every patient can have, typically, like it's a common understanding that asthma patient don't get exposed to cold air. Not everyone is like that. There are some asthma patients who can still tolerate cold air, but for them there may be other triggers which other patients may not have. So it's not like a general rule like that. Triggers can be different for different patients. Another very important trigger which we see commonly is infections. So whenever we see seasons changing, I'm sure you know that a lot of people fall sick. They get infections. Most of them would be viral infections. So these viral infections can also trigger an asthma attack. Some people develop pneumonias, and that can be very bad for asthma patients. So any asthma patient should be aware of these triggers and also take all precautions to prevent infections. Okay? So they can keep their asthma in control. Sometimes managing asthma without taking even medications will be easy. Okay? So that's why these triggers are very important, and every asthma patient should be aware of what their triggers are and avoid them in their life. Okay.
So the next, moving on to the next question would be, sir, what are the causes of asthma?
Yeah, causes of asthma, if we look at what actually causes asthma in a person, why somebody develops asthma, why the other person doesn't. For example, common thing we know is a hereditary asthma, where a mother or a father has asthma and one of the kids also has asthma. There is no dispute here. It is hereditary. This is one form of asthma which is hereditary. Not all asthmas are hereditary. That is one thing we should remember. Not every asthma patient has inherited asthma from their parents or grandparents. It's not a rule. Okay? There are people who have asthma and none of their other family members have asthma. So there is something, we still don't know what actually causes asthma. We don't know what is the genetic defect which is responsible for somebody developing asthma. We still don't know the defective gene which gets transmitted from one person to the other, from the parents to the children. So one form of asthma is hereditary. It moves in families from generations to generations. Whoever is where randomly somebody develops asthma. And there are times where some infections can make a person's lungs very sensitive, and then asthma is unmasked and they start behaving like normal asthma patients and keep getting attacks. To answer your question simply, we don't fully know what actually causes asthma.
So, sir, moving on with another question, how do we diagnose asthma?
It's a very good question and a very difficult one to answer for the doctors actually. Everyone thinks diagnosis of asthma is very easy. It is not. For simple reason that there is no single definitive diagnostic test. Asthma diagnosis is purely a clinical diagnosis where a doctor will, of course, run some tests, but the doctor would mainly like to know what are the symptoms you're having, what is the pattern of these symptoms. I told you already, cough, sputum, breathing problem, wheeze, and chest tightness. These are the symptoms of asthma. And when these symptoms happen, not all symptoms should be there, some of the symptoms even if they are there. And when these symptoms happen, especially when you are exposed to a trigger, we discussed this already, the triggers, and a patient starts reacting, they start developing these symptoms. That is a classic scenario where, it's a very likely possibility that person has asthma. To support this, if there is already a history of allergy of the nose, allergy in the eyes, or if there is any allergy in the throat where there's a lot of itching in the throat in that person, then that supports the diagnosis of asthma even more. Sometimes doctors may do some tests, like a chest X-ray. They may ask a patient to undergo a test called a lung function test, or spirometry we call it, where the person has to blow into a pipe and then, the machine makes some readings. All these tests, and sometimes allergy tests are done, all these tests are only supportive tests to just get some additional information to see or make our suspicion strong whether this person has asthma or not. So asthma diagnosis is purely a clinical diagnosis. And also these symptoms can be different in a day itself. Asthma symptoms can be worse in the night and early morning. And during the day there may be less symptoms. So this variation of symptoms in a day and also variation of symptoms in different days, different seasons, this variability also makes the possibility that the patient will be having asthma, and the possibility of asthma is much more. So diagnosis of asthma is purely clinical, and a doctor should make an effort to spend little time to get some history, get to understand the pattern of the illness, and then make a diagnosis. If required, do some supportive tests.
So, the next question would be, what are the different treatment options available for patients with asthma?
Yeah, so once a patient is diagnosed with asthma and they have symptoms of asthma, the next thing the doctor would do is to give some treatment to make the patient better. And the most common thing which the doctors give are inhalation treatment, where a medicine is given in such a way that the medicine reaches the lung. The problem is happening inside the lung, so the medicine goes inside the lung. It works there. First thing, it will make the tubes open. The second step would be, because of the irritation, the inflammation in the tubes, medicine which stops or reduces that inflammation, such medicines are given in the form of inhalation. Now you can do that in 3 different ways. One is a pump where you put it in your mouth. Usually there is a spacer device, a plastic chamber which is there in the front. You press the pump, the mist-like medicine comes into this, and you breathe through that, and through the air, the medicine enters into your lungs. And it works there to make your asthma better. That is the pump, inhaler pump. The second one is like in the form of a capsule or a powder, which you automatically inhale. There are different devices which doctors advise you to use so that the powder can be inhaled directly into your lungs. That is the second one. The third one is a nebulizer. You have to purchase a machine called a nebulizer. That is different from a steaming machine. The steaming machine and the nebulizer are not both the same. Nebulizer is different. In the nebulizer, there's a liquid medicine available. There's a chamber into which you have to put this liquid medicine, and by the blowing of air through this liquid, the liquid will become a mist, and the mist is inhaled by the patient, and the mist goes inside the lung, and the medicine will work inside the lung. This is called inhalation therapy, meaning the medicine is directly inhaled into the lung and it works inside the lung. That is one form of treatment. Most of the times this works. The doctors know what medicine to be given, how much dose to be given, how it has to be taken, how long it has to be taken. Many times we see patients making a mistake. When they take the treatment, because the medicine directly goes into the lung, it gives relief. No doubt it gives relief. But the sooner they feel better, the patients have a tendency to stop the treatment, which is a wrong thing to do. Because yes, for a short-term benefit, but the allergy tendency is still there inside. The allergy cells are still there inside. So we have to use this treatment little longer period of time so that there is a continued suppression of the cells and you get a longer relief. Okay? So this is the inhalation therapy. Now, sometimes these treatments can fail. So nowadays we have other advanced treatments. One of them is giving injections. There are new medicines which have come now in the form of injections, which are slightly expensive but very effective treatments. And this, again, the doctors will decide who is suitable for what type of injection. There are different medicines available and they work in different mechanisms. The doctor will decide which one suits you the best. Okay? Then after the injections, even if you're not doing well on them, there is another treatment which is a little advanced form of treatment, wherein by doing a bronchoscopy, meaning you must have heard about endoscopy, where they put a pipe with a camera in the front that goes into the stomach and to look at the stomach inside. Similarly, what we call as bronchoscopy is done for the lungs, where there's a camera attached in the front and a pipe is pushed through into the lungs. In this way, what they do is by giving little current thing, they burn the tubes inside the lungs. It's called bronchial thermoplasty. I'm talking in general terms so that you can understand. By doing this bronchial thermoplasty, the airway tubes will not be, constricting so much, even if you get exposed to the triggers. In that way, giving relief to the patient. Now, once again, bronchial thermoplasty is not done in everyone. There are specific criteria, a selection criteria who gets benefited from bronchial thermoplasty and who doesn't. So all the options are available, but it's the doctor's choice. They will decide based on each individual patient who needs what.
So the other question would be, sir, is asthma curable?
Yeah, asthma is not curable. And I can finish this in one sentence. But a lot of people will be disappointed when they hear this answer. There's a good reason for that. Because many times when they hear about asthma, they think this is a childhood problem. When you get older, it will be gone, right? Yes, it may be gone for some very lucky people, but at one point in their life, if they get exposed to something, a very strong exposure, there is a possibility that they may still develop asthma symptoms even then. Now, there is no cure for asthma because we still don't know what is the defect which has caused asthma, right? So if you are born with an allergy tendency, it's very, very likely you will live with that tendency. It is possible for a long period of time, some people may not have any problems. That is very much possible. Maybe because their immunity is so strong, they've got such immunity, or they are not exposed to those triggers which actually was triggering their asthma. Or for any unknown reason, they may actually be doing very well. Sometimes kids, when they grow up, when they become adults, they may not be suffering from asthma anymore. That is also possible. I'm not saying that it is not possible, but to say that the allergic tendency has been completely cured, that is not possible.
So the last question for you is, what are the precautions to be taken to prevent frequent asthma attacks?
Right. Yeah, well, any asthma patient should first know about what is asthma. One most important thing I see in India is the awareness about the disease itself is poor. They don't really understand what it is. And part of the reason why they don't know is because the information they get from some sources is not so authentic. And sometimes doctors don't spend enough time to explain the disease to their patient. And sometimes patients get to hear a lot of myths, false information from sources which cannot be relied upon. Information which has been carried for generations, and myths which have been carried for generations keep having, favorable hearing to many of the patients. So I think first thing the patient should do is understand what is asthma. And in that effort, this video is one such an effort where we are here to increase the awareness about asthma. And to know that what are the features, what triggers asthma and all these things. So first and foremost thing a patient with asthma should do is avoid the triggers. Identify the triggers. If you are allergic to dust, keep your house clean. If there is construction activity happening around your house, keep your doors and windows closed. If you are going out on the road or anywhere outside your house, and if you are going in a four-wheeler, put your windows up. Don't get exposed to the outside dusty environment and air which is filled with pollutants and dust and all. Don't get exposed to it. If supposing you're walking on the street or going in a two-wheeler and you know that the atmosphere around you is not good for you, it might trigger an attack, then protect your airway. You protect your nose with a handkerchief or anything. You have a chunni or anything, you can put it and protect yourself. Simple common sense is required to avoid triggers. If you know that cold air is going to trigger, if you're traveling in an AC bus and you know that AC triggers your asthma and you didn't have a choice but you have to travel in an AC bus, yes, wear a mask. Put a shawl, a clean shawl on your face on something, protect yourself. That way you can obviously avoid attacks of asthma. If your doctor has given you a treatment, use the treatment correctly and for a sufficient period of time. You should know how to take your inhaler. Don't take your inhaler in the wrong technique and keep suffering. Okay? The other things would be when there is a seasonal change, infections are very common. If somebody, your friend, your housemate, your family member, anybody is having infection, stay away from them or ask them to stay isolated and so that it doesn't spread to other people. So you don't fall an easy prey and catch an infection and trigger your asthma. Again, simple common sense over there. You can also go for vaccinations. There are adult vaccinations available. You can take vaccinations like flu vaccine, pneumonia vaccines, and again, you can protect yourself from getting infected. The other thing about smoking, if you are a smoker, it's time you have to stop. Smoking and asthma, they don't go well together.
So this was a very informative and important session on asthma, and we thank Dr. Praveen for providing his valuable time on this session.
Thank you. Thank you.